Indeed, the vaginal wall can become loose, and that happens because of the pregnancies and the deliveries, or just because of age. And in that case, you have a decrease in the gratification during intercourse. So what we have to do, first of all, is to examine you. I will have to see what is the severity of the looseness, and then I will tell you if you are the right candidate for a non-surgical vaginal tightening or for a surgical one. Because what you need in order to have a better gratification during intercourse is to have a vaginal tightening. So just to give you an idea about the anatomy in our pelvis, here what we see is the vagina, that's the vagina. On top of the vagina we have the uterus. In front of the vagina we have the bladder, and at the back of the vagina we have the rectum. So if the vaginal wall, and if here are the pelvic floor muscles, so if the vaginal wall here is not strong enough and it becomes thin and loose and weak, then the bladder will push into the vagina, and that's the cystocele, one kind of prolapse, or the rectum here will push into the vagina, and that's another kind of prolapse called rectocele. Now, if the looseness and the width of the vagina, the size of the vagina is too big, or if there is a prolapse of the bladder or the rectum into the vagina, then in this case, and those are severe enough, then in those cases we will have to do a surgery. We will have to do a vaginoplasty. Vaginoplasty is the surgery where we repair the vaginal wall and we take the excessive skin of the vaginal wall out, and then we suture back the remaining vaginal wall, and we bring back to the right position the bladder and the rectum, and we also reduce, of course, the size of the vagina. Now, the difference between vaginoplasty and the traditional colporrhaphy, or anterior-posterior repair in a traditional way, is that after a vaginoplasty you shouldn't have pain during intercourse, while after a traditional surgery it's very likely that you might have issues during intercourse. In addition, if there is a problem with urine leakage, while when you're coughing, sneezing, running, jumping, you will have a urine leakage, in that case, I will refer you to a urogynecologist. You will have a special examination, and if you need surgery for that, then we can combine the surgery and do it at the same time with the vaginoplasty. Now, what is very important to say at this stage is that even if you have a surgery, even if you have a vaginoplasty for vaginal tightening, this will not change the sensitivity. Of course, the gratification will be better because the size is smaller. However, generally the sensitivity will not change. Plus the quality of the vaginal wall will not change. That's why even if you have a vaginoplasty, it's good to maintain the good result and also work on the quality of the vaginal wall, making the vaginal wall stronger by doing the laser and the PRP. And then definitely strengthen the pelvic floor muscles, because this is something that will not be done during the surgery, so that first of all you have a better sensation during intercourse, and second, to prevent later a looseness to happen again, as well prolapse or stress urinary incontinence to come back.